One approach that we're using is using vaccine therapies to target cancer. In bladder cancer, one approach that's being tested is a combination of multiple different antigens in a vaccine preparation called INO5401. This is an injectable DNA vaccine targeting WT1, HTERT, and PSMA, all of which are tumor antigens that are overexpressed in bladder cancer. It's also combined with an immune stimulatory molecule, IL-12, to allow for the immune system to recognize these antigens and hopefully attack the cancer. And it's being combined with immune checkpoint blockade. In other studies, it's been shown that these DNA vaccines are generally quite safe without a lot of toxicity and therefore have a lot of promise to be combined with immune checkpoint blockade, particularly in bladder cancer where patients often have multiple comorbidities that prevent them from being treated with highly toxic therapies. So this vaccine is delivered via electroporation where there's actually a proprietary system that's used, which is almost like a gun that's applied to the patient's skin that injects the vaccine directly into cells with an electric current, causing the DNA to be taken up into cells and presented to the immune system, along with the immune stimulatory molecule, which then acts in the tumor microenvironment to recruit immune cells. This educates the immune system, hopefully sending these cells out to other places in the body to find these antigens and attack cancer cells. This sort of approach has shown early evidence of efficacy in cervical cancers and cervical intraepithelial neoplasia, which is a virally mediated disease using different targets. But the concept is that the immune system will recognize these and actually attack these precancerous or non-invasive malignant lesions in cervical cancer, and that's being tested in a randomized phase 3 trial right now. In bladder cancer, this vaccine is going to be combined with atezolizumab, one of the PD-L1 targeted immune checkpoint drugs, and we hope to see some data on this combination in coming years. The idea would be that the immune system is now poised to respond to the cancer, and the addition of a vaccine therapy would increase the likelihood of tumor regression in these patients. And it's really being tested first in patients who have progressed following immunotherapy with a checkpoint inhibitor. And the idea that if we see immune responses and clinical responses, that in fact it really is related to the vaccine rather than the continued use of an immune checkpoint agent. This trial is targeted towards patients who have metastatic urothelial cancer, previously progressed on an immune checkpoint agent. These patients have to be fit enough to go on a clinical trial, but if they have progressive cancer on an immune checkpoint drug, the likelihood of them having an additional response to continued immune checkpoint therapy is very low. The hope is that with the addition of the DNA vaccine, that this will induce an immune response that would be durable, and patients would derive substantial benefit from that, and then it would move forward in testing to earlier stage of bladder cancer in larger clinical trials.